Good afternoon, everyone, and welcome to the Texas Developmental Screening and Surveillance Echo, brought to you by UT Health San Antonio in collaboration with the Texas Department of State Health Services. My name is Maria Gutierrez, pronouns are she, her, and I will be facilitating today's session. A few housekeeping items to help with attendance. If you have not done so, please enter your full name, affiliation, and email into the chat. We do ask everyone to please remember to stay muted unless you are speaking. However, we do encourage everyone to use the chat and or use the raise your hand feature to pose any questions or share perspectives with the team. As a reminder, these sessions are being recorded for later distribution. If you are having any connection issues, please privately chat Karen or UT Echo IT for any assistance during today's session. Lastly, today's session will begin with some team introductions, followed by a didactic presentation and a patient case study. We will then move to breakout rooms to help with small group discussions, and we'll end the session back into the main room. We do ask everyone that we ensure privacy is maintained throughout the full session. No personal health information is allowed at any point. This does include name, addresses, birth dates, and other identifiable information. Let us always make every effort to avoid bias and stigmatizing terms so that we can continue to have a space that is respectful and safe to learn. With that, we'll go ahead and move on to some team introductions. We'll start off with Andrea Horton. If you can introduce yourself, please.
I am Andrea Horton, Executive Director at Champions for Children, and I am so glad that you guys joined us today.
Thank you, Andrea. We also have Dr. Dorothy Mandel.
Hi, I'm Dorothy Mandel. I'm an associate professor at UT Health Houston School of Public Health. And again, I also am so excited to see you guys here today.
Thank you, Dr. Mandel. We also have Faith Rivera.
Hi, everyone. Faith Rivera, CEO of Alice Civitas Consulting. Thanks so much for taking time to join us today.
Thank you, Faith. And last but not least, our didactic guest speaker for today, Patty Rosenlund.
Hi, I'm Patty Rosenlund, and I'm the Executive Director of Easter Seals in the Rio Grande Valley. Thanks for having me today.
Thank you for joining us, Patty. We're so excited to have you join us today and have you be our guest speaker and case presenter for today. With that, I think we can go ahead and get started with our didactic presentation. We want to make sure we have enough time for that and enough time for some Q&A as well. So Patty, you may take it away as soon as Karen shares that screen with us.
We'll start with just the required disclosures, and the views and opinions that are in this presentation are those of my own and do not reflect any official views or policy of UT Health San Antonio. And I have no financial conflicts of interest to disclose concerning the presentation. Moving on to the unconscious bias disclosures, UT Health San Antonio ECHO recognizes that language is constantly evolving, and while we make every effort to avoid bias or stigmatizing terms, we do acknowledge that there may be unintentional lapses and that may occur in the presentation. We value your feedback and encourage you to share any concerns related to language, images, or concepts that may be offensive or stigmatizing. Your input is always helpful in refining and improving presentations and ensuring they remain inclusive and respectful of participants. So with that, we'll go to the topic of the presentation today is we screened them, now what? So we've always, the ECHO presentations are always very informative. And so we kind of are all here in a group of on board with the importance of early screenings and doing early identification of any potential delays, but really then what? So these are snapshots of Real Child Care Center at my organization. And we have an early intervention specialist working side by side, one of the kiddos in the classroom, and then just two other snapshots of kids within the center. And it's always good to start a presentation with kind of a level set that I see a lot of folks from child care centers. And although I'm not at our child care center every day. I don't do diapers. And I was telling the group earlier, it's my greatest joy when my world doesn't make sense. I run back to the child care center because they help me make my work make sense until they start smelling funny, and then I'm out. So really applaud the work that you do with children every day. So that on the next slide, this presentation is really based on ASQ screening project that our organization did through our Help Me Grow project. I'm going to talk to you a little bit about that, but we're all from all across the state. And I don't know about you, but when somebody says which county, I'm like looking at the state and trying to figure out where that is. So if anybody wonders about the Rio Grande Valley, usually people can find Texas, but then it may go all the way down to the tip of Texas, as we call it. So my organization really supports programs in a 4-county area at the very border of Texas. We are known for beautiful beaches of South Padre Island, and we have the best grapefruits, Ruby Reds. It's a world birding destination, and we have a wonderful bicultural community as we sit right on an adjacent border with Mexico. So the ASQ, if you go to the next slide, I want to tell you about how this project really started. Through our Help Me Grow work, we are Easter Seals is the backbone or implementing organization. So we have all these wonderful partners within our Help Me Grow network. And for those of you who may not be as familiar with Help Me Grow, there are 4 component areas that all Help Me Grow communities across the state and across the country work from. And that's to really have a centralized access point where referrals can come in and be distributed to an organization or a trusted partner that can meet the need or identified need. Family and community outreach, where we join together. And if your organization doesn't have a particular program or service or support, we can reach out to our trusted partners and provide that network. And then child healthcare providers, which is kind of where the strategy that I'm going to talk about today lives. And data collection really drives our strategies, our process of improvement, and really the work that we do. So kind of looking at that child healthcare provider outreach component is, we had 2 strategies. And I'm talking about last program year that we did this project. One is to have a physician champion. Ours happens to be an audiologist, but she is adamant about early identification, particularly hearing loss, but all developmental areas. So we work closely with her and really have her be a spokesperson for that closed loop referral system. Then a second strategy was to identify 10 childcare centers to support the implementation of ASQ screenings, provide consultation, provide support in sharing results and activities within the childcare center. So we have one position within our Help Me Grow program or framework that is a healthcare outreach navigator. We kind of shortened that to a child development navigator. So she did the primary work. So I'm going to show you, beginning on the next slide, I'm going to just show you 10 steps that we did with this project. So starting with planning, we said, okay, we need to get our navigator trained in ASQ. So she went through the train the trainer, thinking that that would bring value to a childcare center so that she can train the childcare teachers and staff and give them a certificate for their training. So we did that. Then number 2, we had to identify potential childcare centers. So I already told you that under the Easter Seals umbrella, I have a childcare center. So kind of gave me a leg up a little bit. I'm already in that network, right? We're a TRS 4-star center. So we had our childcare licensing contacts and our TRS contacts. So if you're not in that system, you also have access to that. But I kind of moved into that pretty quickly and easily because I knew my folks. So we asked them, tell me, give me a list, place to start from on childcare centers that might welcome us in. So we had an initial list to start with. So with the initial visits, we set up contacts and meetings with childcare directors to introduce our project, get a commitment on the scope of the project. And not everybody said yes. Some childcare centers, because it is a commitment, some said, oh, we're not there yet. I thought you were just going to come in and screen for us, and I could use that support. And we said, yeah, no, that's not what the focus is. So we had to say, this is going to be, we're going to be partnering over several months, and we're going to join with you to train your staff and to have screening days and review the scoring and help you share the results. So we got those commitments on those steps. Then the next step on the next slide, so that was all part of the planning process. Then we moved to implementation. So we got the commitment, we're at the child care center, and we said, okay, next step, you need to talk to parents. We'll help you draft a letter if you want. Some did, some had it, but we wanted to collect and review the consent. So we got the consents in hand. Then we began the process of training staff, small groups, large groups, one-on-one. Kind of really working within the child care center. As you know, it's not always just gather your child care center teachers. It's not that easy. We had to kind of find their best place to do those trainings. Then we kind of taught them how to do the scoring. We did side-by-side scoring. For those who had it down, we went ahead and reviewed the scores. We kind of looked for any trends or any clusters, not only with the center, but maybe within different classrooms where there some concerns that clustered around early reading skills or fine motor, just kind of what were those concerns. And then any of the screenings that were done that really stood out, really below that cutoff score on and really kind of reflected a need for further assessment. We really did talk about this both to the child care staff and parents, that this is a screener, not a diagnostic tool, that this is a moment of time. So just to kind of de-emphasize the total value. I wanted to mention that some centers, we did parent scoring and teacher scoring. That didn't play out that well. Parents were like, I don't know, I'm not with them. I haven't observed this. So although it didn't give us a lot of comparative data to what the teachers saw, it did give us information, right? That parents acknowledged that they hadn't really observed some of the skills. So that brings us to implementation, step 9. And then on the next slide is number 10, which is the big step. We had to share the results. So it was a process of sharing the results kind of with the staff and then with parents. We did a variety of approaches. Some centers said, you do it. If we're the ones delivering the bad news, they're going to fire us and they think it's us. To no, we have a rapport with our parents and we feel confident doing, but you just come in case I need your support. So all over the map, we did groups, more groups than individual. I would say the individual meetings were 100% with kids who needed further assessment or identified that need. But most just kind of in that above the cutoff or close to that gray area, we did group meetings. We did share Learn the Signs Act early at all of those meetings so parents could really hear that this was a screening tool, not a diagnostic tool, that they too are part of this process. And they can, it's not a mystery, right? It's not our magic. They too can be part of the developmental tracking of their child's milestones. We provided, this was kind of a benefit for the child care center. So we worked with the child care center and gave them, at the end, we gave them the ASQ toolkit, and we gave them several sample activities with manipulatives to go in so that they could have a learning center to help it give kids the opportunity to practice skills that kind of trended that there was a need for their group. We also gave parents activities and showed them, gave them materials to kind of help them do things. And we selected activities that were primarily like gross motor activities, some fine motor activities that would be while they're in the car that they could do, or on the weekends that they could do. So fun activities with the description of the activities and the manipulatives that went with it. Another sort of focus on that need for further assessment, we provided a physician letter that's in the ASQ material book. We didn't need to create it. And we, in some cases, gave it to the parent and said, here's a letter for your next pediatrician visit, and you may want to talk to them about this screening and think about what they see what they say. Some kids, we said, let us help you with an ECI referral. My friends in ECI can do this referral. A little disclosure, our person that was working with the child care center came from ECI, so she had all of that language down very well. And she did that warm handoff to ECI, made it very smooth and supportive of parents. And sometimes we forget that that's a scary thing. But then again, in that evaluation from ECI, the parent is naturally included. Lauda, our navigator, in some cases actually joined the ECI team. So it went together very nicely and made that process go more smoothly. And it had a good connection with strengthening that relationship within your ECI community as well. So those are the big 10 steps. And then we celebrated. On the next slide, we said, well, celebrate the why. The teachers got training certificates. We established partnerships not only with our Help Me Grow and Child Care Center, but then ECI and the healthcare professionals, which really brought in and strengthened parent engagement. They received ASQ activities, an activity book, and the kit. And then they really kind of built that bridge with ECI for not only a moment relationship, but ongoing relationship. And I know that's happened because this year, as we begin the project again, some of the centers from last year called and said, we're doing our screenings, but could you help us with the scoring again? Or could you come to the family results meeting? So they wanted that support, and we're happy to do that for some of the centers. We didn't do the whole thing, which is a great step in the right direction, but continue to support them on the areas that they requested. So at the end of our project last year, the results were we implemented ASQ screening process with 17 childcare centers. You may remember I referenced we identified 10, but word got out, so we got calls. And this was a great, the timing was good as TRS requirements were coming into play, and it just strengthens the quality of childcare centers and really helped them set set up a system. We also had different systems. Some we provided with like a vertical file so they could have, these are the consents, these are the screenings that were done, these need continued monitoring, these we need a ECI referral, these are some activities. Some liked the vertical file system, some had a notebook. So we kind of introduced some system level approaches to help them get organized and do it. Of course, I think childcare centers are the most organized people in the world, but kind of nice to give them the structure of that. So we completed 1,699. Don't ask me why we just didn't do another one. So it was a nice round number, but that's what it was. So a lot of ASQ screenings completed during this project. And on the last slide, I just have sort of a look at how this project really wasn't just an isolated to-do. It was really a multi-system coordinated effort for early identification and ongoing support that really supports that early identification that we all know gives better outcomes for children, improves parent engagement, includes parent voice, really kind of building that collaboration with parents, provided access to resources and new supports that child care or parents may not have been aware of, closing those gaps, making that early preschool time really impactful before they hit school, and strengthen those relationships with not only healthcare providers, but again, with ECI. Collaboration with the healthcare providers, working with them, and making it, building a really efficient and effective system that is really starting the process of that data-driven planning that childcare teachers already do, but this is kind of formalizing that approach. And that's the baby she's telling you, right? She's just telling it. So thank you for the opportunity for sharing this project that had positive outcomes for us. And hopefully you could relate to any bits and pieces of that.
Thank you so much, Patty, for that amazing presentation. I'd like to open up the floor to anyone that might have any questions or comments for Patty regarding today's presentation. Please feel free to unmute or use the chat.
I have a question, Patty. We've used ASQ and done the online tracking and we've found that online system to be a little challenging. Do you have any advice or experience with doing the online tracking with ASQ?
I agree with you. We do have access to it, and we've even thought of like having it on an iPad and working side by side. We've sent it to parents, thinking parents would like it better. And I thought it was just me. So thank you for that comment. We've just been more successful with the paper as well.
Thank you. That's what we've found as well. So actually, that's really validating. Thank you.
Likewise. Thank you.
Yeah.
Any other questions or comments for Patty? Yep. I do see a question in the chat for you, Patty. I'll go ahead and read it out loud. When a new child care center opens, how can it be added to their program?
How can it be added to their program? Help. I'm not sure I understand. How can you add ASQ?
Mm-hmm. Yes. How can it be added to their program? It looks like they are wanting to open up a center by the end of the year. Veronica, if you're able, do you have any other additional information you'd like to add to your question?
No, I'm in the beginning stages of doing my business plan to present to the bank to open the account. And I just want to get all the programs that are out there to help parents and children once the center is open. So definitely interested in the ASQs, as I've had experience already with them at our center that I work at right now. So I would like to have that in the center that I open later on in the year.
So you're already familiar and you could probably implement that system. Are you familiar with early childhood and intervention, ECI, in your area?
Yes, yes.
Okay, so you already got a good partner. You already know about ASQs. You're good to go. I would totally put it in all of your pitches, and
Okay.
it's setting you up for Texas Rising Star for the quality that you're gonna monitor development. And
Okay,
yeah,
okay.
sounds
So
like you're
just
good to
wasn't sure,
go.
like I had to call y'all and say, hey, I want the program, or I just reach out to the ECI person that I already know
You
from
could
here.
you could do that if you have a
Okay.
concern, but if you're already familiar with ASQ, you're good to go to implement.
Okay, cool.
But
Thank
as a
you.
partner, if there was a concern, that would
Mhm.
be where I would recommend you start building that
Okay,
bridge with ECI. So if you have a child who has a concern and a need for further assessment, you would have them
okay.
a relationship built.
Yes. Thank you.
Can I add one more thing, Patty? A plug for
Please.
also something else, the whole umbrella. Also look into your area, Veronica. I don't know what part of Texas you're at, but also look to see if you have a Help Me Grow affiliate in your area. And so Patty has Help Me Grow in South Texas, Central Texas. There's also Help Me Grow. If you're in the Dallas-Fort Worth region, you're in the entire metropolitan area is covered by Help Me Grow. Wichita, El Paso, San Antonio. I think.
Yes.
Yes,
Yeah.
El Paso. Find your Help Me Grow affiliate too, and reach out to the director for Help Me Grow, and they're gonna. You have them. You have ECI. You have support services and family support services for even kids who aren't going to qualify for ECI.
Okay, great. Yes, I'm in San Antonio, so and there is an ECI here, so yes, I will definitely partner with them.
So yes, Help Me Grow and ECI can make your tribe. You can have your people, your community of support.
Yes, yes. Thank you.
I do see another question in the chat from Sharon for you, Patty. How can my center access the ASQ? Does a child care provider need to be certified by the state?
So you know what, I'm going to defer to the Faith, because you guys are all the experts on ASQ. Really, anybody can access ASQ and the training. I mean, I think a director would do great going through the train the trainer, so you can actually train your staff. But parents can do the screening with their children. Teachers in the child care center can do it. Faith, do you want to?
Sure. So, the organization that runs the ASQ is called Brooks Publishing. So they have a lot of information on their website on the trainings they offer, setting up the actual online system. But to Dr. Mandel's point, if you're in one of the, I think, 13 areas of the state that have a Help Me Grow, my recommendation would be at first reaching out to your local Help Me Grow program, just given that they already have a lot of resources and information, and they may already have a program similar to Patty's that is doing screenings and training specifically for childcare programs. So that would be my recommendation: is first start with the resources that are already out there. And then if your area does not have a Help Me Grow, then look directly through Brooks Publishing.
A couple of years back, maybe 2 years, we had someone come in. I hosted a trainer and someone came in. She was the instructor from Texas A&M and did the ASQ. training for, and a lot of centers came in for us to do and to get the training. So you might want to check with Texas AgriLife or the workforce, Gulf Coast, they may.
Local ECI providers are now also starting to do train the trainers. Also, UT Austin provides online train the trainer. So you have to show up, but you can do it virtually. And UT Austin is also providing that training as well. And most of these trainings are free. So put that out there.
Yeah, if you'll search for the Center for Excellence in Mental Health, they are the ones who offer free ASQ trainings fairly periodically.
Thank you, everyone, for this great conversation. I do see a few resources were shared in the chat. We'll make sure to send those out to everyone through the post-session communication email. Due to time, I do want to make sure we do move on over to some announcements. Karen, when you're able, please share the announcement slide with us. All right, thank you, Karen. Please don't forget to claim credit using your TechPeds account and scanning the QR code on the screen. You may also use a link that will be shared via chat and through email as well. If you do not have an account, please make sure you do register to receive credits. Are you interested in presenting a case? Cases can describe a challenge that you are presently facing with a child in your care. Challenges could be around screening, intervention, referrals, or any other concern that you might be needing some guidance on. As a case presenter, you don't have to fill out a formal presentation. To submit a case, please make sure to reach out to us. The link will also be shared in the chat for everyone. Join us at our next Texas Dishes Echo. This will be held on Friday, May 9th at 1 p.m. We'll make sure to send out the flyer once we do have that available for everyone. And lastly, as a reminder, after today's case presentation, we will move on to some breakout rooms for case discussion. After that, we will be moving back to the main session where a representative from each breakout room will share a summary of what was discussed for today. Thank you, Karen. Okay, with that, we'll go ahead and move on to our case presentation for today. Patty, once you see that case up on the screen, you may take it away for us.
So here's the scenario. The Twinkle Toes Child Care Center requested help to conduct ASQ screening at their center. The center serves children 6 weeks through 5 years and has an enrollment of 80 children within their infant, toddler, and preschool classrooms. You're planning your first visit to meet with the child care director and anticipate that she wants you to do the screenings to meet the requirement, either TRS or licensing or something else. You would like to help her see the benefit of training the teachers and setting up a system for regular screenings with follow-up and engaging the parents while sharing the screening results. And questions for thought? How would you begin that conversation with the child care director? What are the talking points that you would use to support training the staff rather than you doing the screenings? And what support or process would you provide to share the results with parents?
Thank you, Patty. Is there anything else that you'd like to add to today's case study? Any additional information?
No, add your own, fill in the gaps. So just kind of that big approach, just kind of think through that approach, particularly when that mindset was, oh, I thought you were going to come in and just do it for us. So kind of think about how you would handle that conversation and sort of shift that conversation to empowering the child care center.
Thank you, Patty, for that. Now we'll be moving on to some breakout rooms. We'll give Karen just a few moments to set everyone up. So please make sure to accept that breakout room once it is prompted on your screen. Welcome back, everyone. I do see some folks are still trickling in, so we'll give it another 5-10 seconds or so. Okay, I think with that, we can get started with some summaries from each group. Let's see, Faith, you're the first one up on my end. If you'd like to share the discussion that happened in your breakout room.
Sure. So when we started talking about the best way to kind of begin these conversations with staff and even with parents, our group really talked about ensuring that we focus on the benefits of screening for the families, for the children, for the center as a whole, ensuring that the staff have buy-in, that they're a part of the decision-making process and that they know what is coming down the pipeline, and that you start having these discussions early on so that they're prepared to have these conversations with their parents. And then some talking points that we discussed is that the providers and the center staff really see these children every day. They know these children very well, and they're the best equipped to be able to do the screenings and to support the development of these children, utilizing observations to kind of guide conversations and the tools that are being used. And then also helping to share with parents why it's important to screen all children, not just children that there is potential concern for. And then some folks also had mentioned that sometimes there are irregularities between what parents feel is happening at home and what providers feel is happening in the classroom. So utilizing the tools like the checklists and the screenings to be able to really help show the parents of these children see what their children are coming to the classroom and experiencing to be able to get them the best resources and help.
Thank you, Faith. We'll move over to Dr. Mandel.
So yes, everything that Faith just discussed was also discussed in our group. Our group also discussed the importance of using this as an opportunity to build capacity within the child care centers, and that not just bringing someone in to do it, but also bringing someone in that helps train the director and helps train the staff on being able to identify issues and to also be able to do the screening and know what the screening's for and how to move forward and how to turn it into developmental monitoring. There is that was the added part in our group.
Thank you, Dr. Mandel. And now I'll hand it over to Andrea.
Yeah, our group, kind of same, but also, what we talked about was, why would you encourage a teacher that they can do this? And just that the teachers know the kids, like has already been said, they're in there with them all day long. A stranger's going to have a hard time really identifying the answers to these questions. But also helping our teachers remember that it's a screening and not a diagnosis, and that it's not really putting that child in a box with a diagnosis that's going to follow them the rest of their life. It's just an observation. And so don't feel so nervous about it, but also being able to have partners to be able to reach out whenever there is a delay, when there's that hard conversation that you have to have. Can you find a partner that might help you have that conversation and share, just share with that parent to help them. And I shared that, our goal is knowledgeable and confident parents. And so giving them some tools and some evidence of what's going on with their child that will help them make good decisions for their kids. And so I am going to, I think, interrupt me if I'm not in the right place, but I'm going to kind of just review now the class, the lesson that we learned, and get ready to close this out. And so we learned about how important it is to do ASQ trainings in the daycare center. And some of the takeaways that I got: number one, training is important, that it is really important for us to know how to do the ASQ and for our teachers to know how to do the ASQ. So reaching out and getting trainers training on how to do the ASQ is really important. Second, sharing the results with the parents. So that's not just something that's internal to the daycare, but something that our parents can utilize and learn more about their child. And then finally, that we want to celebrate the why. When our teachers learn and implement developmental screenings, they're getting extra training. Our parents are getting engaged. We are having access to more and better developmental resources, and we're building collaboration and partnerships with other agencies outside of our childcare to continue to support that family. And so I love what Patty said kind of at the end. Our goal here, early identification and early access to supports, and what an incredible difference that can make in the lives of our children.
Thank you so much, everyone, for today's discussion, and to the Hub team for those great summaries. Let's see. I do see that a few people have been asking for the survey and tech picks code that has been shared in the chat again by Karen. So please make sure that you do click on the link, create your account, and claim some credits. As a reminder, we'll also be sending out this information post email if you're not able to get it during today's session. With that, we'd like to thank everyone for joining today's session. Thank you, everyone, and we hope to see everyone soon. Thank you.